Good afternoon, ladies and gentlemen, and welcome again to our monthly press conference. As always, we have some folks joining virtually. So if you have questions and you want to get them in, we ask that you please funnel those through the channel. A member of our team will echo those questions verbatim to the Secretary. We will get to those questions at the end once everybody in the room has given their questions. As always, those in the audience, if you have a question, I will call upon you. If you could just come to the front, to the mic. You are allowed to take off your mask at that point so we can understand you. And you have an opportunity to ask an immediate follow-up also after that. At the end, if there's more time and you have other additional questions, by all means, raise your hand. I'll call upon you again and you're able to come back to the mic again. So I know we have a lot to cover at this time. So with that, I'll turn it over to Secretary McDonough.
Thanks very much, Terrence. Good afternoon, everybody, and welcome to our guests from Defense Media Activity. Really glad to have you with us. It's been a busy month, a good one, so let's get right down to business. First, I'd like to thank all of the vets who are watching today. Veterans Day was last week, but as I said last week, that's not only a time to honor vets or to remember what they've done for us, it's also a call to action. President Biden demonstrated that once again last week at Arlington, announcing the new steps we at VA are taking to make sure that veterans exposed to burn pits and other environmental hazards finally get timely access to world-class care and benefits. The first of those announcements is that we are now piloting a new process to evaluate presumptive conditions at VA. For years, VA determined presumptive conditions using a restrictive process, one that focused primarily on data from the National Academies of Science. Those days are over. We are fundamentally remaking that process, replacing it with a new model that will consider all available data, a model that allows us to listen to and learn from vets' experiences, and that is guided by one core principle: getting vets the benefits they've earned and therefore deserve. Second, at the President's direction, we will use this new model to assess associations between environmental exposures and constrictive bronchiolitis, certain rare lung cancers, and other rare respiratory cancers. And we'll have answers on the cancers by early 2022, and on constrictive bronchiolitis by summer 2022. These announcements are part of our broader efforts on environmental exposures, including our announcement from earlier this year that, for the very first time, after 30 years of war in that geography, we are presumptively providing benefits to Gulf War veterans who suffer from asthma, sinusitis, and rhinitis. We've already processed more than 6,900 claims. We are delivering over $14 million in benefits to 4,682 veterans and survivors, and those are benefits they so rightly deserve. This is only the beginning of our efforts, and we'll keep moving ahead with urgency. Next, I want to update you on our efforts to address homelessness. We set two ambitious goals for ourselves in October to address veteran homelessness in Los Angeles. One, get all of the roughly 40 homeless veterans living on Veterans Row, the homeless encampment out in LA, into housing by November 1st. And two, get 500 additional veterans in LA into housing by the end of the year, making sure they're home for the holidays. I'm proud to say that with the help of our great partners, we've accomplished that first goal, and we're on our way to accomplishing the second. Since October 1st, when we made this commitment, 304 veterans in LA have moved into permanent housing or into VA transitional or emergency housing, on a path to permanent housing. And I'll note that all of our homeless prevention efforts will be bolstered by our decision last week to increase housing assistance for vulnerable vets in high-cost rental markets like LA. Specifically, our Supportive Services for Veterans Families Grant Programs, or SSVF, can now cover up to 50% of a veteran's rent in specific markets. That's an increase from the previous 35%. And we've increased the maximum amount of time that vets can stay in emergency housing from 45 days to 60. These steps will be critical for getting vets into housing and keeping them there, both in LA and across the country. As I've said before, we're meeting vets where they are to get shots into arms. You may recall that in September, we hosted a vaccination and benefits event for deported veterans. One of those phrases that should not exist in the English language, at the border between Tijuana and San Diego. Yesterday, we hosted another event for deported vets, this time at the Bridge of the Americas border crossing in El Paso. 19 veterans and family members participated, receiving vaccinations for COVID and the flu, and they also received benefits counseling from our VBA representatives. We'll continue doing this work with DHS and other partners, reaching out to deported veterans to ensure that they're able to access VA services that they've earned. Because when we talk about fighting like hell for vets, we don't just mean some vets. We mean vets, all vets. And this is one of those fights. Let me focus on boosters for a moment. We're seeing a plateau in daily cases across much of the country. We're seeing an increase in cases in certain geographic regions, even in areas like New England, with relatively high vaccination rates. So it's important for eligible veterans who have been vaccinated to go ahead and get the booster. It adds an important layer of protection. We've made some good progress getting boosters into vets' arms. Of the 3.4 million vets currently eligible for COVID boosters, about 630,000 have already gotten the booster. That's 19% of the eligible vets have gotten the booster. Now, there's likely some vets we're not tracking who already got their boosters outside of VA. It's important that all veterans know if they got their second shot of Pfizer or Moderna 6 months ago or longer, or got their first dose of J&J 2 months ago or longer, they're eligible for boosters. And any of the vaccines can serve as their booster, regardless of the type of vaccine they received for their first vaccination. Now, I've heard some people may worry that if they get a booster, they're taking vaccine away from someone who needs it for their first shot. There is no shortage of vaccine. As President Biden said earlier this month, we have ample supply of boosters. So vets should get their booster when it's their turn. Our work in the pandemic is far from over, and everyone needs to be vaccinated. Lastly, let me close this month's presser the same way I did last month with the story of an unbelievably great VA employee. This employee's name is Sherman Free, a nurse at the Houston VA. Sherman retired after spending more than 30 years as a nurse in the Air Force and at VA. But then the pandemic hit, and he decided to come back because he said, for me, the pandemic was a call to duty. As a veteran and a nurse, Sherman continued, this is where I belong right now. These patients are my brothers and sisters. These patients deserve the best, and I'm honored to do my part to give it to them. That's the ethos that permeates VA. Partners like Sherman who will do whatever it takes for the vets who fought for us and to make sure that those vets have the most access and best outcomes possible, even if it means coming out of retirement to do it. That type of dedication is the rule, not the exception among Sherman's colleagues at VHA, who are now delivering care to veterans where they want it, when they want it, like never before, whether it's at home, in the community, or at VA. In fact, VA is now providing more care to more veterans than ever before, both via direct and community care. And outpatient trust scores have risen to 90% this year, proof that veterans trust VA to provide world-class health care that they've earned and that they deserve. By the way, go to va.gov/trust this afternoon, maybe even right now, to see VA's most recent trust report. This will be the third quarterly trust report that we release in one of our efforts to be increasingly transparent to our stakeholders about what vets experience here. So, va.gov/trust. So I say thank you to Sherman, to the more than 125,000 vets like him who work at VA, and to all our great VA employees. You've stepped up in this time when vets needed you most, and in so doing, you've made VA a better, stronger department for those we serve. I could not be more grateful to you. That's all I got for today. I look forward to taking your questions.
Ellen.
Hello, sir. As you
Hi,
know,
Ellen.
hello, Millheiser Synopsis. Thank you for doing this.
Thanks for coming.
This morning, Representative Rosendale, ranking member of the VA Committee's
Yes.
Technology Modernization Subcommittee,
Yes.
point blank said he wants the EHRM to be canceled. He does not think the Cerner program is effective, cannot be moved beyond Spokane. I know that you have faith in it. What are you doing to show Congress that this is an effective program?
Yeah, it's great. Good question. Thanks so much. I haven't directly seen Mr. Rosendale's comments, but obviously we take them very seriously. Just this week, Deputy Secretary Remy spent a day and a half in virtual meetings with the team on the ground in Spokane. He was actually meant to travel there, but the flights to Spokane and to Seattle on Sunday afternoon were canceled. Importantly, in direct response to your question, one of the things we're doing is urging members of Congress to see for themselves what's happening at Spokane, one. So Deputy Secretary Remy did invite several local members to visit with him. I had a conversation on the Hill myself this morning about this topic with Senator Murray, who raised it with me. We had a staff and a congressional delegation that visited. I think that was also virtual earlier this fall. And of course, we've been testifying in open session and briefing extensively on it. But it's important to understand that we said we'd make a decision by the end of the year about where to go to next. We've not made any announcements on that. We're continuing to work through this, and we will continue to work through it to be confident that when we make the next steps, it's in the interest, first and foremost, of veterans, but also in the interest of our clinicians. So bottom line is we're staying on top of this. We're learning the lessons that we can learn from the experience in Spokane. When we have next announcements on it, we'll let you know. Yeah.
Adam.
Afternoon, Secretary McDonough.
Hey, Adam.
So it looks like there has been some statistics released from the Pentagon recently that indicate there has been a rise in enlisted suicides in 2020, unfortunately. And it looks like there's also some discussion on the Hill to support legislation and policies to really address this. Does the VA have potential interest or movement towards supporting these as well in light of the considerable work that VA has done in addressing veterans' mental health crises and suicide prevention?
Yeah, thanks for the question, Adam. It's obviously the most important clinical priority that we have here in the building and across the country. I can't comment about the specific bills you asked about because I haven't seen them. We are constantly in communication with members of Congress and their staffs about the steps that we're taking on suicide prevention and on mental health care promotion. Importantly, I think you've probably seen the public affairs efforts that we have underway at the moment, promoting gun locks and promoting what we say, don't wait, reach out. So promoting planning and making sure that veterans and families are in touch with mental health professionals and are aware of all the services that we provide here at VA. So can't comment about the specific bills without having seen them. Obviously, in regular touch with Secretary Austin and his team about our shared priority on this and constantly working this issue. I will say just for a minute how distraught I am about the news from CDC on the numbers of deaths by overdose in the course of the pandemic. It's very alarming. It's an issue that we've also made a major priority at VA over the course of the last several years on substance use disorder and on making sure that we're employing best practices on prescribing and pain management across the system. But the news in the last day about that surge in deaths by overdose in the course of the last year is very alarming and something that we're continuing to work.
Thank you.
Yep.
Leo.
Thank you, Mr. Secretary. I had a question following up with the White House announcement on toxic exposures.
Yes.
You said we're looking at early 2022 on the cancer review and summer for, I'm sorry, what you said?
Constrictive bronchiolitis.
What is that marker? Is that when we'll actually see decisions made, or are we looking at, I mean, the bottom line is when are veterans going to be getting
really good
benefits
question.
from this?
Really good question. So what we're doing now is reviewing the science to establish the connection between the rare respiratory cancers, the rare lung cancers, and military service in this geography during this period. That's the first thing the President's made clear that he wants to hear from us on that by early 2022. That would, if we're able to establish that connection, and then if we're able to establish the connection between service in this geography during this period and constrictive bronchiolitis, which is a malady that many of our vets suffer from, then in early 2022, we would start the rulemaking process for the rare cancers, the respiratory cancers, and the lung cancers. And then same in summer for constrictive bronchiolitis. So then the question is, how long does rulemaking take? Well, we don't know for certain, right? Because this is governed by an independent process that under the Administrative Procedures Act need be independent. We can't comment about it. We're going to be very careful about it so we don't trip up and complicate efforts for vets to get access to care. But if you look back to the first three presumptives that we rolled out, it was about 90 days from establishment of the connection to the publication of the rule, an interim final rule, which allowed us to begin receiving claims at that time. So 90 days from start to finish, having established a connection to receiving claims. And I just gave you the numbers on the claims that we've received to date, a not insubstantial number. Not saying that our work is done, it's by far from done, but I think an important first step. All of that is to say, Leo, I think you should think about early next year plus 90 days for the rulemaking. So end of spring, if all it goes according to plan, then we could be in a position to be adjudicating claims. That is still the fastest route from here to making good on what so many of our veterans are owed. And that's been my argument all along, that the fastest path from where we are now to the provision of benefits and care that these vets so richly deserve is through this process. We're making it faster, we're making it more transparent, we're making it more responsive and more based on veterans' experience. And I hope that means at the end of the day, that will mean more access.
And can you speak just to what that scientific review includes? Because one of the points in the White House announcement was that they're going to look at, or you're going to look at the science differently than in the past. And does that mean lowering standards? Does that mean looking at, just walk me through that.
Yeah, it does not mean lowering standards. It means increasing the aperture of available science. So yes, the National Academies is important, but that's not the sole source for science. There's other sources for science. Importantly, at the president's direction, the White House is doing what I think the White House does really well, which is establishing an interagency process led by the Domestic Policy Council, where around the table we have all the agencies with available science: DOD, VA, HHS, Department of Labor through OSHA. And then there's obviously science available to us among, for example, firefighters. We spent a lot of time dealing with toxic exposure. So we're widening the aperture to science and available science first. Second, we're also, as my remarks suggested, of the belief that every individual claim is important. So we're urging veterans to file their claims, because in those claims is really important data, information, even intelligence for us to figure out what veterans are experiencing. Importantly, not just the individual claim is important, but aggregating similarly situated claims and applying data analytics to those similarly situated claims can also provide us information that will help us make decisions about presumptive conditions. So that's what I mean, and that's what the president meant by what he's demanding of us and the urgency under which he's demanding we operate.
Great, thank you.
Yep.
Darius.
Amen.
Thanks for getting to me. Back in August, Senator Grassley sent a letter to the VA and yourself regarding state veteran homes. There were 7 different questions, so I don't want to go through them all just in the interest of time, but he requested a response by September 24th. I was wondering if the VA had gotten back to them and what
I'll take a look at it.
Take a look at it. So I can follow up with Terrence on the status of that answer then.
You sure could, yep.
Okay, thank you.
Eric.
Eric?
Hey, Secretary. Sorry for being a bit of a broken record here, but I wanted to ask again about last month you discussed how you were still compiling the figures for the internal vaccination rates. I was wondering if you have an update there on the rate that's vaccinated, the rate that has requested some sort of exemption, and if you have numbers on, how many people have started going through the disciplinary process.
Thanks very much. I mean, we hold these press conferences for the vets who are watching, for our workforce who's watching, and for you guys. So you never have to start your questions by saying sorry. We're actually here for you. So that's one. Two is we are at, as of this morning, according to our VHA leadership, 94% of documents uploaded into our system, meaning we're not quite at 100%. I don't have data for you underneath that in terms of vaccination rates. I hope we have that soon. We are in the midst of employing our disciplinary process, the first step of which, as I announced last month, is counseling. That counseling is increasing, clearly, our response rates, and hopefully that will also give us good numbers when we have the whole, we have all the responses in. What I've said about what we can anticipate relating to requests for, or declarations of really, exception is under the flu mandate of a year ago in 2020, we had 5.6% of healthcare professionals having claimed a religious exception. I don't know for sure what the number will be. I am fairly certain, however, that the number will be higher than the 5.6% that we experienced with the flu mandate.
Okay, so just to clarify that, the 94%, does that include people who have put in a exception request, or is that?
It does.
Okay.
Yep.
Thank you.
You bet. Thank you.
Lisa.
Hi there. Just following up on Eric. So has anyone at VHA been fired for not being vaccinated?
No. Not that I'm aware of. I'll double check that, but I think I would know that. That would be a decision that's handled at the facility level, but that has not happened yet.
Okay, so
So if I
roughly-
could just maybe
okay,
step back for a second, Lisa, and just repeat what I said last month, which is the disciplinary process that we have can stretch out as much as 3 months, start to finish. Which I've said to you guys here in this room, and I've said to others, I'm comfortable with, because the goal of this, obviously, is vaccination. At the end of the day, the goal is not, relieving.
Different.
Yeah.
Right. I understand, and I remember that. Can you give us an estimate of how many employees at VHA are in some process in the disciplinary process?
I bet somebody could. So can we take that? I can't give you that right now.
Okay.
That man. Yeah, it'd be
Okay.
probably this man right here. He's going to get a lot of follow-ups.
Okay, I mean, is that something that we could expect to all learn from Terrence through your great staff?
I hope so. I hope we can get you some precision on that. I also hope that in the relatively near term, we're at where we need to be in terms of knowing the full picture that tells us how many vaccinated, how many with exceptions, and how many in process. So my promise to you has been, when we have that, we'll get it to you. On your specific question of how many people in some kind of disciplinary process, I think we can get you that too. That might, however, have to wait until we've got the 100%, which I think we're pretty close to, in as much as we're at 94%.
Okay.
Does that make sense?
Yeah, I think that's good. And then the last thing is, you said at your last availability that, you felt that people asking for religious exemptions would be likely to get them because those things are hard for VA to parse.
Yes.
But that you would be aggressive about letting people go if their unvaccinated status conflicted with the agency's mission. Is that now starting to happen, where the staff is kind of going through these exemptions requests and saying, you know what, this person, it's not going to work out. They need to be in the category of being fired if they are not vaccinated?
Yeah, I totally understand the question. So So let me tell you what, I don't recall precisely what I said, so let me restate what I meant, irrespective of what I said. Here at VA, the act of getting a religious exception is a self-executing act, which is to say you assert a religious exception, therefore you have a religious exception. Right. That was a policy decision we made that tracks the policy decision that was made last year when VA did the flu mandate. Period. Next paragraph. Nevertheless, we do run a healthcare agency. So there are certain areas in the administration of healthcare, oncology, ICU, spinal cord injury facilities, our community living centers, CLCs, our long-term care facilities. Those are 4 areas, for example, where it's possible that the concentration of religious exceptions reaches a level such that we can't assure the veteran patients there that we've done everything we can to ensure their safety because not enough staff are vaccinated. Mm-hmm. If that's the case, then we will have no choice but to deny the religious exception. And right. Then that employee has a choice. Now, that will be done pursuant to policy, pursuant to well-established guidance, so that it's not capricious in individual facilities. It's something that's done, established to, pursuant to established policy and practice.
But is that happening now? I mean, what is happening now?
No, what's happened now is, 3 things are happening now. One, we're getting all the data into the system so that we know precisely what we're dealing with. You know, the first time I talked about this with you guys a month ago was 70%. I gave updates to some of you along the way. We were at 81%, 91%. This morning we're at 94%. So we're just about there. That's one thing we're doing. The second thing we're doing is we're counseling. Right. That's helping drive up the numbers, but it's also helping people ask questions that may still have questions. The third thing we're doing is we're planning in the event that we have to relieve people in certain sensitive areas, that we have capacity across the system where we can deploy people to cover shortages. So those are the 3 things that are happening. The process of actually sitting with someone and saying, well, it's time for you, we've now determined that this is not an available option for you, that's not started.
Okay.
Okay?
All right. Thank you.
Thank you. Okay.
Ellen.
Appropriations.
Yes.
This morning, House Appropriations Committee Chair Representative DeLauro said that a full-year omnibus is not an option.
Full-year CR is not an option.
Full-year CR.
Yeah.
Have you spoken to anybody on the Republican side of the aisle concerning the VA's need for money for community care, to expand these presumptions, to run these modernization programs? Y'all have a lot of very expensive stuff coming up in the next year. And if you have spoken to Republicans, are they sharing any kind of concern that there won't be enough money?
I'm very concerned about a full-year CR. And we've communicated that concern to members, Republicans and Democrats on Capitol Hill, and we've shared it publicly. There'd be very serious ramifications for community care. There'd be very serious ramifications for direct care, meaning there'd be very serious ramifications for care for our veterans. I am very concerned about that. I can't characterize any Republican or Democrat, for that matter, their personal feelings about this. That's a question for them. But let me just underscore again, I'm very concerned about the impact of a year-long CR.
Have you all started any internal planning on how you'll manage that?
You know, we do a lot around here, Ellen. We do a lot of planning.
Thank you.
So, sir, I think we'll turn it over to some of our virtual questions.
Great.
Hi, Mr. Secretary.
Hi.
Our first question is from Quill Lawrence with NPR. What's the state of the claims backlog, and will the new presumptives on toxic exposures affect that?
Yeah, good question, Quill, and thanks for joining us virtually. As I announced last month, and we had, if I recall correctly, a good back and forth with Leo on this, because of the kind of the passage of time related to the 3 new presumptives for Agent Orange passed in last year's Defense Authorization Bill. That was for bladder cancer, Parkinsonism, and hypothyroidism. Those claims spilled into the backlog. So the backlog, Quill, expanded earlier this month, on the 1st of this month, I believe, to about 260,000 cases. You recall that when we got here, we were about 250. When I arrived here in February, we were at about 215,000. We worked that down to about 170,000. It got as high as 215,000 because of the pandemic and the necessity early in the pandemic to stop things like C&P exams. We cranked up C&P exams, including the provision of C&P exams in the VA system, not just through contract providers. That number then went back up to about 210,000 because of the Blue Water Navy claims. We worked that down again to about 185,000, then it bumped up this last time to 260 or so thousand. We're working those. I think we're working that in a number of ways. Mandatory overtime, staffing enhancements, and our plan, as I've announced in here before, gets us down under 100,000 claims, backlogged claims, by, I want to say, end of year 2023. We are also planning at the same time, direct response to your question, for the increase in claims for toxic exposure. Take, for example, we anticipate 300,000 claims related to the 3 conditions that we announced earlier this year. I met a vet recently who told me that his life has been changed by chronic sinusitis and resulting CPAP, that sleep apnea that he's suffered as a result. He was thrilled that we had made this decision. He had been 3 times denied. He has a new claim pending. There's 300,000 we anticipate veterans and similarly situated. That's why we have gone out and we are hiring 2,000 additional personnel at VBA, slightly more than 200,000, slightly more than 2,000. It's almost, in fact, almost 2,100. That's both claims raters as well as the backbone of people, human resource professionals, technologists, to support them so that as they come on board, we can get them trained quickly and get them working. It's in anticipation of the toxic exposure increase that we've gone out to make those hires. By the way, that hiring is going pretty well. We'll have more data for you, I think, probably by the end of the year on how it's going. But in terms of number of applications for the openings and so forth, I'm keeping pretty close tabs on that, and I'm very happy to see that. So I hope that's responsive to Quill's question.
Our next question is from Dan Sagalin with PBS NewsHour. Why do you think it's taken VA to open the aperture and look for data? And why do you think VA has not done this in the past? He also has a follow-up question.
Yeah, Dan, that would be a good question for the former secretaries or others. I don't have an answer for that.
When you open this
Yep.
might be related to that.
Yeah.
When you open the aperture on data on illnesses to see if they should be presumptive, will you publish that? And will you publish the data when you look at all the data and decide not to grant a presumptive?
It's a good question. I I think it's a fair question. I don't have an answer to that. And why don't you let me take that and come back to you with an answer on that. Here's what I've said in this room before, and this is what my commitment is. I have these press briefings once a month. I have update meetings with our scientists on the questions of toxic exposures once a quarter. I've promised that coming out of every meeting, I will give updates to you here in this room, to Congress in open session and through briefings. And if in that process it makes sense for us to give data, I don't see any reason why we couldn't or shouldn't. But before I commit to that, let me just make sure that I talk to everybody. But it seems like a very reasonable request.
We have a question from Patricia Kime, a freelancer. Can we get an update on the caregiver review and how many new folks have joined and how many are being removed from the program?
It's a great question. So we are going through, by virtue of Congress updating the caregiver program, we are now accepting applications, or we will shortly be accepting applications to that new program and the new requirements of the new program. We, at the same time, have to, by virtue of the congressional action, go back and look at people who were entered into the program prior to October 1, 2021. 2020, October 1, 2020. We are doing that case by case. I think you go by Patty, if I remember right, but Patricia, I don't have that data at my fingertips. We'll get that for you. I would just say one other thing, which is we're also in conversations with our friends on the Hill as to how we can ensure that access to the program, including the new version of the caregiver program, is consistent with congressional intent as it relates to overall numbers. And so that's something that we're thinking about as we look back at the legacy program, but in particular, it's something that we're looking at as we look forward. And so we'll be working this through and whether that, and we'll remain in close consultation with Congress on this because I think there is a critique that the program has been too narrow cast. It's a critique I take to heart, and it's a critique we're making sure that we can address, and including, if we assess it to be a fair critique, including expanding access to the program if we can find a way to do that consistent with the statute.
And Quill has a follow-up.
Naturally.
How much education training will be needed for the new presumptives, and will VBA be ready in time?
It's a good question. We kind of thought, so let me answer the question this way, and then maybe what would be kind of a cool thing is maybe the next monthly we have somebody from VBA come in and just talk you through the training. It's well-established training program now, which means we do think that we will be ready. So the answer to your question, will we be ready? Yes. Then the next natural question is when. I think we'll be ready with the people hired and properly trained. I had hoped by the end of the year. I'm worried that that might be slowed down by operating under a CR. But surely early in the new year, we'll have those people hired up and trained and ready to go. That's it?
That's a final question, sir.
Okay. Looks like, yeah, go ahead, Leo.
One more quick one before we let you get away here. I've heard from quite a few veterans who are worried about the extension of the coronavirus emergency provisions related to the GI Bill.
Yes.
I know Congress, this has been pending before Congress.
Yes.
I don't know what your level of concern is that we haven't seen any action on that yet, and if you're talking to folks on the Hill, pressing them to move that quicker, and if you have contingency plans for if some of these students, if it doesn't happen, how to help these students out.
Yeah, so I am worried about it. The witching hour is next month. We've begun those conversations with the Hill. And, you know, they do have, they are making consideration, they are preparing for end of the year activity in both House and Senate. And so I hope we can get it done there. In terms of contingencies, you know, we're constantly looking at our programming and making sure that we're doing everything available to us. But some of these emergency provisions are statutorily based. And so we're going to need Congress to get them done.
Great, thank you.
Thank you. All right, thanks everybody. Let me off the hook. Appreciate you.
Thanks, sir. This concludes the ceremony.